The image quality of modern echo machines is really superb, but it still doesn't come close to a photograph. In very many cases, you will have structures on the image which really don't belong there. And this is what we call artifacts. This chapter will deal with such artifacts and will help you how to distinguish them and to determine where they come from. When the ultrasound machine generates an image, it makes a number of assumptions. For example, that the ultrasound really travels in a straight line at a constant rate of attenuation, that the speed of ultrasound in the tissue is always 1,540 meters per second, that the beam is indefinitely thin, and that all echoes generate right from the center of this beam, and that the reflector, in other words, the structure which should be displayed in the image, can be calculated simply from the time that it takes of the ultrasound beam to return to the transducer. Now, in reality, this is not always true. And where these assumptions are not met, or where other physical principles come into play, we get artifacts. Take a look at this image. The image quality is superb, but then there are still some structures which cannot be explained simply by anatomy. For example, what are those structures which move down here? And why are the echoes so bright right here? And why do we have shadowing? Well, the object of this chapter is to explain why artifacts exist and how to interpret them. Why is it important to know about artifacts? Well, because we can confuse them with pathologies, they can obscure the view to structures you'd like to see, and because quantification can sometimes be a problem. I would like to tell you a story. Many years ago, I was called to a patient who had acute chest pain, and the question was what the cause of chest pain was. Now, he didn't have any ECG changes and he had no regional wall motion abnormalities, but what I found was linear structures in the ascending aorta. This is not the same patient, but a patient who has just the same finding. Now, the patient I investigated had a known dissection in the abdominal aorta, so I was kind of convinced that dissection was also present in the ascending aorta, which is an indication for operation, and that's where I actually sent him. Well, fortunately, we also performed a TE study, and there was no dissection. And we also performed CT, and there was also no dissection. What we saw was an artifact. As a matter of fact, an artifact which is not so infrequent. This is a reverberation of the aortic wall, a form of artifact that I will be discussing in this chapter. But now let's look at it from a systematic perspective. Well, there's very many different types of artifacts, and in reality it's often very difficult to say why or what the cause of artifacts is. Here's a list. We have near field clutter, side lobe artifacts, reverberations, beam width artifacts, acoustic shadowing, attenuation, rib artifacts, mirror imaging, and double images. So you see, the list of possible artifacts is quite long. And in reality, it's often difficult to say which form of artifact is really present. But I just want to show you some typical artifacts and show you how they appear on the screen. The first type of artifact I would like to discuss is the so-called near-field clutter artifact. It is located close to the transducer, in other words here at the tip, and it is caused by high amplitude oscillations of the transducer. How could this influence your interpretation? Well, this patient has an infarct and also a higher likelihood for a thrombus. But what we see here is not a thrombus. Those are just artifacts caused by near-field clutter. And what are side lobe artifacts? Well, side lobe artifacts occur because the ultrasound beam very often emits another or other beams as well, which are generated from the edges of the transducer elements. Now, this signal is a bit weaker and also takes a bit of a different direction. But if the reflector is strong, it can still return to the ultrasound transducer and a signal is then generated. The machine, however, thinks that the signal is generated from the main beam and therefore assigns it a position which is false. The typical finding in side lobe artifacts is that we have an equidistant artifact and the structure looks rather blurred. I already mentioned the term reverberation. In this figure, I would like to show you what it is. We have a transducer here, and this transducer emits an ultrasound ray, which is reflected from this boundary and then comes back to the transducer. But the transducer itself is also a reflector, and therefore the ultrasound beam is again emitted towards this boundary here, where it is again reflected and comes back. The result is a second impulse. And since it takes much longer for this second ray to come back to the transducer, this second impulse is projected further away from the actual boundary. Usually twice the distance, because it is reflected twice. This is reverberation. And reverberation is one of the causes for the so-called mirror artifacts. A type of artifact you will commonly encounter in patients who have quite good image quality and very strongly reflective surfaces. This is an example of a mirror artifact. So focus your attention to this part of the image here. So you see structures here which move but which are clearly outside the heart, and they resemble the mitral valve. So this is just a mirror of the mitral valve. Obviously this can't be another valve. It's highly unlikely that our patient here has a valve within the stomach somewhere. So an example of a mirror artifact. Now I would like to show you what the so-called multipath artifact is. This is our transducer, and from this transducer we have an ultrasound ray which hits a boundary. Okay, so from this boundary we have a reflection normally back to the transducer. This is the normal situation. But then we could also have a ray which is diffracted towards another structure, and from there it bounces back to the transducer. In this situation, the ultrasound machine is fooled, and it will portray another structure which is further away than the actual structure, because the path that aberrant ray took is much longer than the actual distance between the original structure and the transducer. I already discussed beam width artifacts in the section on 2D imaging. Just briefly, if we have very broad beams, then a structure might be hit by two beams, and thereby the ultrasound machine is fooled into believing that there are actually two different structures and not one. This does not happen if we have a narrow beam width. Acoustic shadowing is a very frequent finding in ultrasound, and in particular also in echocardiography. It happens if we have tissue which either completely absorbs or reflects the ultrasound beam, and then we have a shadow behind these structures. This is the image of a fetus where we hit the bone, and then we have a shadow behind the structure. What attenuation does to an ultrasound image has also been mentioned previously. We can either have shadowing or enhancement of the ultrasound signal. How does that come about? Well, in the case of shadowing, we have a structure which is fairly echo-dense, and then we have a lot of energy loss, a lot of reflection of the ultrasound beam, and a weak signal right behind this dense structure. In contrast, if the structure is very echo-weak, then we do not have that loss. As a matter of fact, we have less loss than in the region left and right to it, and thereby more energy behind the structure, and thereby the structure here appears brighter than those on the side. You can also create artifacts if you use a false gain setting, in particular if you overgain the image. In this case, you not only lose lateral resolution, but you also tend to obscure the information. For example, you cannot appreciate the texture of a structure anymore. And you will also overestimate the size of structures. But here is a demonstration which shows you exactly what I mean. If you use gain settings which are too high, you can also create artifacts. Here's an example. Here's a kind of a 4-chamber view angulated towards the right ventricle. Take a look at this structure here, right here. And now if I increase the gain, all of a sudden the structure will look markedly larger, and you could have the impression that it's some kind of a tumor. So obviously the gain setting is not optimal here. Go back with the gain setting and you will immediately see that it is just a normal part of the interatrial septum. We can see artifacts in very many different situations. In patients who have very good image quality because we have very strong reflectors, which, as you've seen previously, can cause all sorts of artifacts. In patients who have poor image quality, attenuation is often a problem, and also the lungs, air. A specific problem is also calcification, as it occurs, for example, in patients who have aortic stenosis or mitral annular calcification. And finally, a lot of artifacts are seen if we have prosthetic material. See what I mean in the following demo. Here's an example of artifacts caused by prosthetic material. What kind of prosthetic material? Well, an artificial valve. Here you see that the entire left atrium is shadowed by these artifacts. And we also see that there is motion within these artifacts simply caused by the opening and closure of the prosthesis. Okay, so you've heard a lot about artifacts, but the question remains, what can we do to avoid them in the first place? Well, the first thing to remember is know the pitfalls, and I hope you will now after this presentation. Beware of strong reflections. Know the anatomy. Use multiple views. Why? Because artifacts are usually very inconsistent. And if you vary the transducer position, these artifacts will either vanish or significantly change their appearance. But artifacts are not always bad. Here's a story a colleague once told me late at night at a conference. And he told me about a student he had in this lab, and that student was really getting on his nerves because he kept on asking questions like, what is this on the screen and what is that? And so my colleague said, you know what I did? After some time, I just told him they're artifacts. And then finally, after some time, the student stopped asking questions. So I guess you can also use artifacts to your advantage. So the lesson from this chapter is, if you don't know what a structure is, just call it an artifact.